Well, good morning. On January 5th, our government put in place additional public health measures to blunt the transmission of the Omicron variant. At the time, we were seeing very concerning trends emerge. Cases were rising steeply. Percent positivity nearly hit 40%, 10 times higher than when Omicron was first identified in Ontario. Hospitalizations were doubling every 7 days. The data was clear. We needed to act. Today, we know it was the right decision. Percent positivity has now dropped to 15.9%. New admissions to hospitals are starting to slow, and patients are spending far less time in the hospital when admitted. And our health system workforce is stabilizing, with more people coming back to work than calling in sick. As I said at the time, while necessary, the additional measures were always intended to be time limited. They were one more tool to blunt the spread of Omicron and protect our hospitals. The evidence tells us that these measures are working and that we can expect recent trends to continue as Omicron cases peak this month. And while we can be confident in how far we've come, I want to be crystal clear, we're not out of the woods yet. The coming weeks will continue to pose real challenges, especially to our hospitals. But these are challenges our hospital system can manage. We can be confident in our ability to care for people, to provide hospital beds to those who need them, and we can be confident that the worst is behind us as we look to cautiously ease public health measures. As we do, Ontario will repeat the success of the past reopenings. We're taking a phased approach with 21 days between each step to make sure we haven't moved too fast. Starting January 31st, businesses in Ontario will return to 50% capacity. For the first step, arenas, concert venues, and theaters will be capped at 500 people. Social gatherings will increase to 10 people indoors and 25 people outdoors. If trends remain stable or improve, Ontario will move to the next step on February 21st and then March the 14th. Minister Elliott will provide more details on what's included in these steps shortly. But before she does, I know there'll be some who wish we could move faster. As I said, we need to remain cautious, especially with students going back to class this week. And I know there may be some who say we're moving too fast. Now, we want to be absolutely sure these positive trends continue as we move forward. And we want to do everything humanly possible to avoid having to go backwards. If that means pausing between steps for a few extra days, we won't hesitate to do so. The best way to make sure we keep moving forward, the best way to protect our progress is by getting vaccinated. If you haven't already done so, please get your first or second shots. And if you're eligible, boost up as soon as you can. Because so many of you have come forward for your booster dose, Ontario leads the country in third doses. This is fantastic news and something we should all be proud of. But it shouldn't stop us from wanting to do more to protect our families, our communities, and our hard-fought progress. So please do your part, get your shots. It's never too late. Thank you, and God bless the people of Ontario. Now I'll pass it over to Minister Elliott.
Thank you, Premier, and good morning, everyone. As the Premier mentioned, earlier this month we made the very difficult but necessary decision to put in place additional public health measures to prevent our hospitals from becoming overwhelmed. At that time, our government announced that these measures would be in place for at least 21 days, subject to trends in public health and health system indicators. We are now approaching the end of that timeline, and thanks to the sacrifices of Ontarians and unwavering efforts of our healthcare workers, these measures are starting to have an impact. There are some positive signs that we may be reaching the peak of the Omicron wave in Ontario. However, we still need to remain humble and cautious. That's why, as we prepare to safely lift public health measures, We will continue with a gradual and cautious manner that has always guided our decisions. In the absence of concerning trends in public health and healthcare indicators, Ontario will follow a cautious and phased approach with 21 days between each step. Starting with January 31st, 2022, Ontario will begin the process of gradually easing restrictions in effect under the modified Step 2 of the Roadmap to Reopen. This includes increasing social gathering limits to 10 people indoors for social gatherings and 25 people outdoors. Capacity limits will be increased or maintained at 50% for a number of indoor public settings where proof of vaccination is required, such as restaurants, retail, gyms, and religious services. Spectator areas at sporting events, concert venues, and theaters will be permitted to operate at 50% of the usual seating capacity or 500 people, whichever is less. Proof of vaccination requirements would continue to apply in existing settings. Should trends remain stable or improve, Ontario will move to the next step on February 21st. At this time, we will increase social gathering limits to 25 people indoors and 100 people outdoors, and remove capacity limits in indoor public settings where proof of vaccination is required. Spectator capacity at sporting events, concert venues, and theaters will be permitted at 50% capacity. And capacity limits in indoor public settings where proof of vaccination is not required will be limited to the number of people that can maintain 2 meters of physical distance. By March 14th, we intend to lift capacity limits in all indoor public settings and religious services and ceremonies, and increasing social gathering limits to 50 people indoors with no limits outdoors. Proof of vaccination requirements will be maintained. Final recommendations on moving to each step will continue to be based on the recommendations of the Chief Medical Officer of Health, and we are committed to remaining cautious and responsive as we continue to respond to the Omicron variant. As we start to see some hopeful signs and begin to ease measures, I want to remind Ontarians how grateful we are for their sacrifices to keep one another safe. And to our healthcare workers, pharmacists, and other essential workers, it has been a long and difficult road through this pandemic, and it cannot be emphasized enough how indebted we are to you. As I mentioned yesterday, there's no question we will continue to face challenges in the weeks ahead. However, if we remain steadfast in our gradual and cautious approach, as more Ontarians continue to receive their vaccine and we begin to roll out antiviral treatments, and as we continue to use the full resources of our healthcare system, I am confident that we can manage the challenges before us. Thank you.
Before we take questions from the phone, we'll move to the floor first.
Hi, Premier. Matthew Bingley, Global News. Last October, you presented a plan that had a very ambitious opening plan that saw at the end of March the loosening of restrictions to the point where you were saying that masking would no longer be necessary and vaccine passports would no longer be necessary. Under this plan, it appears that March 14th, vax passports are still necessary at that point, and I didn't see a mention on masking. My question to both you and Dr. Moore is, do you think that you were overly ambitious with that original plan? And do you see a point where in cold weather, where we see cases rise, such as next fall, that these steps would probably be necessary, the vax passport and masking, to continue?
Well, first of all, back in October, we didn't see the spread of Omicron, and we saw the spread taking off at the beginning of January. That changed the game, and I'm 100% confident that that was the right decision when they gave us the data. And there was 3 things that we had to focus on. First of all, we saw the spread. The positivity rate was 40%. Those are staggering numbers. 4 out of 10 people were getting Omicron. Now we see it drop down to 15.9%, so that's positive. We saw the cases of the hospitalizations, where they were doubling every single week. Now we're seeing that ease. And another big factor was the absenteeism of our healthcare workers, but not just our healthcare workers, other businesses right across the province. So we're seeing a positive trend. We're still very cautious, and I always say we aren't out of the woods yet, but we're taking a cautious approach to move forward. And I'm confident that we're going to move forward cautiously and get things back to normal as quickly as possible.
Dr. Moore, do you have anything to add?
No, I think the Premier's response was absolutely right on. In October, we had no understanding that Omicron would be declared a new variant of concern November 26th. We had a good plan in place for Delta, and thanks to all Ontarians, they were getting immunized, they were following all the basic public health measures to ensure safety in our communities. So we've responded to a new variant quite appropriately. Sadly, we've had to put public health measures in play present to best protect Ontarians and the healthcare system. And again, thanks to all Ontarians for the sacrifices they've made. It's made a difference. Our health system has been able to provide the right care at the right time for any patient with COVID-19. Certainly, we're at capacity in the healthcare system. We've made sacrifices for elective surgeries to be able to provide that capacity, but all Ontarians are receiving the care that's required at present, and thank them once again for their sacrifices. And we have to be adaptive to any new variant, and Ontarians have done that for Omicron. We do see light at the end of this phase of the pandemic, as the Premier has outlined, and we do see hope that the sacrifices have been worth it by the businesses affected. And like any public health measure, they have to have a time-limited place. And now that we've anticipated the health system being able to provide the right care at the right time for all patients in Ontario, we're absolutely prepared to remove the measures in a cautious and gradual, staged and phased approach.
Premier, the CFIB says that 1 in 5 businesses is on the verge of financial ruin and collapse. I know that you've already pointed to some of the supports that have already been presented, but they are saying that even with restrictions lifted, consumer confidence isn't there and they will suffer going forward. What more does your government need to do to add financial support to make sure that they don't collapse?
Well, first of all, my heart breaks for the businesses. I'm a business-minded person. All business, I get it. I understand how tough it is to meet payrolls and meet the sales coming in and meeting all the challenges, but we've stepped up to tunes of billions and billions of dollars. We just put out a $10,000 grant. We're also making sure that they were taking care of their electricity costs and other areas of support from the federal government as well. Folks, you know, when we get back out there, I encourage you, go in and support your local business. Go out to the restaurant, even at the 50%, please take a night out at least a week and go to your local restaurant and support them, either takeout or you're able to sit inside. But make no mistake about it, I understand. I fully understand the pain they've gone through, but we'll come back. We'll come back strong out of this. Our economy is strong. I'm going to say it'll be like the Roaring 20s. We've seen 160,000 more people employed right as we speak right now than we did prior to the pandemic. We've created the environment for companies to come from all over the world and open up businesses here. We need more people. We need another 315,000 people to fill the jobs. So I'm confident about the economy. I'm feeling very confident. We're going to cautiously open up, and we're going to get back to normal as soon as we possibly can. I can tell the business owners, I can't stand closing them down. I know the doc knows it. I know the minister knows it. But health is a priority, and I follow directions and advice from our health team, and that's what was able to get us through the last few weeks.
Okay, we're ready to move to the phone lines for questions. First question, please.
From Rob